Hello, I'm Katelyn Llewellyn. I'm a student of Dr. Marcel Brouwers in English 298, and my qualitative research project is on public perception of alternative medicine and identifying demographic-specific opinions on this specific topic. So, alternative medicine, or CAM, has many unresearched benefits that need to be uncovered in order to expand medicine, and minority groups often experience the most disparity and displeasure with their medical treatment as it currently stands. Therefore, expanding CAM research is opening doors to inclusivity and empathy in the medical field, as well as financial prospects for companies. Complementary and alternative medicine is often considered to be voodoo or fake medicine. This is mostly due to its relations to different religions and cultural practices that aren't regular and normalized in today's society. With proper research, however, many of these methods have been found to be effective in the treatment of many different ailments, from cancer to sports medicine to even the common cold. This study is conducted with the purpose of analyzing the general public and their opinions about CAM, especially in terms of demographical identification. This insight can provide resources and information that helps the medical field to advance the way they treat CAM and the way they view these treatment options. This can open the world of medicine up to many people in places where they may feel underrepresented. In order to acquire this information, an online survey was created with about 15 questions. We posted this survey to reddit.com on the subreddit r/sample size. About half of the questions were about demographical identification, asking about gender, religion, ethnicity, etc., and the other half were about their individual opinions on CAM. This included the likelihood to use it in the future, how useful they feel it may have been, and if they'd even encountered it before. We obtained 32 viable responses from this method, and this information was then analyzed in order to establish results about these opinions. The major results found that a greater proportion of women, who were the majority but also fairly evenly split on the survey size, were showing a much higher likelihood to attempt CAM in addition to their usual medical treatments rather than male or non-binary individuals. While the female individuals were the higher proportion of the survey size, it is worth mentioning that they would try this because many medical issues are attributed to being less understood and less taken care of when they belong to women than they are to men. Yet another important result of this study was to show that non-Protestant, especially atheistic respondents, were much more likely to attempt to use CAM. It's worth noting that atheistic respondents were not much more of a prevalent statistic within the study, and that it was about evenly spaced among atheistic and Christian respondees. This is mostly attributed to the cultural implications of CAM and how there are many roots of alternative medicine being in other religions. Therefore, if somebody is not tied down to a religion, they're more likely to explore their options than somebody who has devotions that would counter the other religious beliefs that are in tandem with CAM. As one can see, the results from the survey usually revealed about 53% of feminine identifying respondents and 43% of those being over 30 years old. This is worth noting because young people are typically more willing to try new things, so it is curious that older people, especially women, were more open to this. They were mostly college-educated and Protestant Christians. However, the non-white and non-Christian respondents, however few they may be, showed the most positive responses to CAM usage. This is, once again, related to the cultural implications, but is also due to the unrest that many patients feel when it comes to their current medical treatment. Many studies have been conducted that show that there is generally a gender and ethnicity-related basis for distrust of the medical field. This is due to a lack of research in certain areas where minorities and women are more highly affected by certain illnesses. This can include strokes, high blood pressure, hypertension, and many other similar issues. Overall, it is imperative that can be expanded and researched in a way that opens the door for many patients, doctors, and businessmen worldwide to understand more about the world we live in. Thank you for listening.